say what you consume is what makes who you are. The food we eat, and more importantly, how fast or slow we consume, show how much we love and take care of our bodies, particularly at a time when a pandemic has left us thinking how misplaced our priorities are and leading us to obesity, dependence on alcohol, stress, long working hours, overworked minds, underworked bodies. It has therefore become imperative to follow and respect our gut. Keeping your health needs in mind, the Times Group, with its motto, Change Begins Here, brings to you Follow Your Gut, the most underrated organ. Today, we are in conversation with one of the world's renowned gastroenterologists from Kansas City, who is also the member of University of Kansas Center's Cancer Prevention and Control Research Program, Dr. Prateek Sharma. Dr. Sharma, welcome to the session. Rapid lifestyle changes, nutritional indiscipline, and irregular eating habits are the main concerns of various lifestyle problems, among which gastroesophageal reflux disease is one. It is one such disorder that can affect any individual, irrespective of age group. However, people tend to neglect it and self-medicate to reduce the discomfort caused by the same. Dr. Prateek Sharma is here with us to tell us about how one needs to nip it in the bud before it manifests into larger issues such as esophageal ulcers, esophagitis, and aspirational pneumonia. Dr. Sharma, if you could lead us to the session on GERD as part of TOI Follow Your Gut, the most underrated organ. Please tell us.
Thank you for that introduction, and my congratulations to Times of India for paying attention to the gastro symptoms or the gut symptoms, which obviously are very important. Initially, we'll be discussing gastroesophageal reflux disease. Gastroesophageal reflux disease, or GERD, or acidity, is a very common symptom worldwide. So it's no longer a disease of the West or symptom of the West. And studies from India actually show that 20 to 30% of the Indian population also suffers from gastroesophageal reflux disease symptoms.
We are often told the gut is the second brain in the body. Perhaps the reason why we say follow your gut instinct. How closely are the chemicals released affecting the gut? Why do we say rely on the 22-foot long gut? Because it never lies. Dr. Sharma, please tell us about the connection between the brain and the gut.
Sure. It's very important to recognize this, and thank you for bringing it up about the gut-brain axis. And it's a very important function that it plays. And it's basically to have a very good coordination between the gastro and the gut functions and the brain. And it's linked to the emotional and the cognitive centers of the brain, which controls a lot of tasks, such as intestinal functions and mechanisms leading to immune activation, intestinal permeability, or the absorption, which is related both of food as well as drugs, as well as the release of some what we call gut hormones or enteroendocrine signaling. So this gut-brain axis really plays a role in this communication involved between the brain, the immune system, the endocrine system, and the gut. So it's extremely important. We try not to use the term psychosomatic, and the reason is because it seems to indicate that they're not in a way real, and people or patients sometimes get offended by those. So what we use is a term which is called now functional gastro disorders or functional gut or GI disorders. And these disorders are a very heterogeneous group of disorders. The underlying pathophysiology is not very clear, but it is well known that it's related to the gut-brain axis, and that leads to a number of these issues, such as functional diarrhea, functional constipation, functional, abdominal pain, things like that. And in this situation, what happens is that the patients have a very heightened perception of visceral pain, of neuroendocrine symptoms, immune functions, and which can be precipitated by psychological distress. And so I think that's why this functional, symptoms of heartburn, dyspepsia, IBS, you've all heard of irritable bowel syndrome. I mean, those are all very common examples of functional GI disorders.
So, do you agree when it comes to matters of heart, we rush to the hospital, but when it comes to heartburn, we tend to self-prescribe OTC drugs to manage the symptoms?
People tend to ignore their gastrointestinal or their gastric or their GI problems or gastro problems. People tend to self-treat themselves when it comes to acidity or acid reflux or heartburn. And, if it's minor in nature and you get it after eating a particular type of food or a spicy chicken or pizza that you enjoy, I think it's fine. But in the long run, if they're persistent, it's probably not safe to do that. And it's probably good to see your physician or your gastroenterologist. And in fact, studies have shown that the optimal use of these over-the-counter medications, specifically for heartburn, are more likely to be done if they're prescribed, by a gastroenterologist or a physician.
Thank you, Doc. In fact, I was just going to come to the Omicron now. Now with this virus also coming to this, hitting us during the pandemic time, what are the common gastrointestinal issues that you have actually come across in cases during the COVID times? Are there any specific ones that you'd like to share with our viewers?
Yes, I think it's important to know that and in fact, we have done studies here in Kansas City looking at gastro symptoms in COVID patients, and we find that about 20% or 1 in 5 patients admitted with COVID or having COVID symptoms will have gastro symptoms along with it. And these are specifically nausea, vomiting, diarrhea, some abdominal cramps. So, it's an important issue because if somebody starts getting some, other symptoms of COVID, such as fatigue or malaise and some fevers, and along with that, if you start having some of these gastro symptoms, they may be suggestive of COVID.
Right. And the common problems that mostly Indians have reported is of GERD. And could you tell us a little about the impacts of persistent GERD on our body?
Persistent GERD, can be an issue in the long run. Reflux disease or acidity, as it's commonly called, or many people in India also call it as gastritis. They're all referring to having some symptoms from their acid in the stomach coming up into the esophagus. And you can see that when the acid comes in the esophagus where it should not be, it can lead to inflammation or irritation of the esophagus. Over the long term, this can lead to scarring of the tissue in the esophagus, which leads to a narrowing of the esophagus, what we call esophageal stricture. The inflammation can be widespread and it can cause ulceration in the esophagus. And finally, the most dreaded of all of this is that over time, this could lead to precancerous changes within the esophagus, a condition which is called Barrett's esophagus, which is a precancerous condition. And obviously by that, it means that finally it can lead to esophageal cancer.
What do you suggest people suffering from the condition should do for relief and not take it lightly or self-medicate?
Yes, so initially, depends on the severity and how is it impacting your quality of life. And we take that seriously because this is mainly a symptom-driven disease and not a physician or a diagnostic test, driven disease. So if you have symptoms of GERD or acidity or gastritis, which is, as I said, very intermittent, related to specific foods, to specific conditions, and if you take over-the-counter, antacids, and it goes away, I think it's fine to do that. But if it persists and if that medication does not take care of it, or if you start having these symptoms, twice or thrice a week, then I think you need to go and see your physician about it and not take it very lightly. The other thing also to, digress a little bit from the gastro condition and go to the cardiology condition is, of course, having angina or chest pain or, heart disease. So sometimes this burning sensation may be difficult to differentiate from that. So if you're having chest pain right behind the breastbone or the left side of your chest, don't blow it off as indigestion or gastritis, as many people do, because that could be a sign of a heart attack, especially if it's associated with, difficulty breathing, some arm pain or jaw pain or things like that. Then, you should be concerned about a heart condition.
During COVID, Doc, a lot of, it was a common practice in India to actually have those concocted drinks called kadas, which is like a, secret drink that all the mothers force it down your throats. So tell us that actually, does it really help having those concoction drinks, or, is it actually going to harm your body if you have too much of it?
Yeah, again, good point. This is all, based on opinions rather than very good science behind it, because just as you rightfully mentioned, this kada or this concoction may be different in different families, and basically what it is, gives you a little bit I think the hypothesis in the past when medications were not available, or good diagnostic testing was not available. It was to give the person a little bit of, vitamin C, to give them some, drugs or concoctions which have some anti-inflammatory properties, in there, which would, and also immune boosting agents, and which are now available in fruits such as berries, have a lot of immune properties, things like that. So I think the concept in the past was a good one, and I think if you take this concoction, maybe you get some viral type symptoms or some sore throat, and you take it once, I think it is fine. It's not going to harm you. The problem arises when people, as you rightfully mentioned, start taking it 3, 4, 5 times a day and for days in a row. Then they can start harming you. So it's like anything else. Even a medication, if I prescribe an antibiotic or something, there's a dose to it, and I will say that, okay, take it once a day or twice a day for 7 days, and then you stop it. It's not saying, okay, here's the antibiotic, take it however many times. More is not necessarily better. So what we are finding out, not again just in the US but in India also, is that if a lot of this herbal and dietary supplements, or these concoctions as you call them, are taken, they can lead to liver damage. And this new thing which is called as drug-induced liver injury, or herbal and dietary supplement induced liver injury, now accounts for 20% of all cases of liver injury in the US. And I think in India, exact numbers may not be clear, but I would suspect, if anything, that they're probably higher than 20%. And again, this is not specific to either India or to the US. Even there are data from Spain, from Korea, from Singapore, that this drug-induced liver injury appears to be increasing and is common. Everybody says that, okay, you take this, it has got 10 different advantages that it can offer you, but you always have to be skeptical about it. So again, the bottom line or the message is, if you take this kada once a day for a couple of days, I think it's fine, but don't overdo it because it can be harmful.
With this, we end our conversation with Dr. Prateek Sharma. We thank you for your valuable time and your dose of good medicine. We hope our viewers enjoyed the show, but most importantly are aware why one needs to keep one's gut in healthy shape to be able to follow the gut instinct. Thank you, dear viewers, for joining Times of India's Follow Your Gut, the most underrated organ web series.